Thank you so much for your interest in the topic of understanding barriers to access and utilization of developmental disability services facilitating transition. My name is Dr. Christine Drew, and I work at Auburn University. I worked on this project with Dr. Ami Baer, Dr. Randy Phelps, and Dr. Catherine Zuckerman at Oregon Health and Science University. This work came out of an adolescent transition clinic that was conducted at the university. Many families were recommended to obtain services through the state developmental disability service provider. Upon follow-up, we found that many families had not been able to partake in these really helpful supports. We were curious about what barriers the families might be encountering in this situation. We conducted semi-structured interviews with both parents and developmental disability service coordinators who were charged with facilitating this process. Out of those interviews, we found that parents felt the process was quite taxing, both emotionally and time-wise, and that most facilitators or service coordinators agreed with that assessment. Parents also reported that they found the system difficult to navigate, found that they were recommended to these services much later in their child's life than they would have liked to have found out about them. And service coordinators reported that basics such as getting a qualifying diagnosis or getting adaptive scores were really difficult for families in the community. We also found that parents faced further barriers even after they obtained the services. Parents reported they had difficulty finding and hiring personal support workers or PSWs to work with their children. They reported the workers often lacked skills that they needed to work with children with disabilities. And there was high turnover rate, both in service coordinators and personal support workers. In contrast to all of these barriers and difficulties, many parents reported that these services were life-changing. Many parents reported they were able to keep their jobs and felt safe having their child in the community with workers who could support them effectively. In light of all of these barriers, we created a resource toolkit of specific interventions and supports that the developmental disability services providers could create to help increase uptake and decrease barriers for families. I'm going to focus on 3 of them. One of them is known as hiring family navigators to support families in this process. What that looks like is hiring parents of other children with disabilities who've had success in gaining access to these services, training them specifically in things like cultural competency and reflective listening and system navigation, and then having them support parents through the process. This can also ease the burden on service coordinators who reported that the DD or Developmental Disability Services system is quite overwhelmed. We also found that many parents had difficulty navigating the system and would have preferred to have an online portal or some very clear handouts about qualifications or not qualifying for services, and also making sure that these were easy to access in many languages. Last but not least, we suggest that Developmental Disability Services opens up a feedback loop with their consumers. This could look like focus groups, surveys, or other ways of getting information about how satisfied consumers are with the services or the barriers they're encountering. This way, developmental disability services could plan proactively rather than reactively. This could help ease the burdens on families and the service coordinators and the system itself. We know that parents want to support their children. They want to gain access to services to help their children prosper and grow in these situations. Any of our suggestions would be helpful, and we're hoping that with this research, we can support families and help the state support them as well. Thank you again for your interest in our topic of research. We have really enjoyed working with families and service coordinators to get a full picture of the lived experiences of our clients.